Do not ask your competitor. Do not ask the dude down the street, hey, what do you charge for PRP? Do not calculate, well, the cost of the kit is $250, so we'll just double it and charge $500. That is not the correct math to figure out pricing. Do not read the article that tells you to charge $1,168 based on a national survey. Because basically that's just like asking your neighbor, except we asked a lot of neighbors. I'm Dr. Ariana Demers, the queen of Orthobiologics, and I am leading the way in orthopedic surgery innovation, shaping medical practices for success. No one has really done all of the research of what goes into the actual cost of an orthobiologics clinic and how you price that. So don't do any of those things. And then the last thing, or maybe last two things, don't feel bad about charging what you're worth. And the second part of that is we have been brainwashed to think that we are not worth the money that patients are paying, that we're charging. We've been brainwashed. When we talk about money and we talk about price, we're like, I just talked to somebody today and they thought that $500 profit was, quote, enough. They didn't need to make more. They didn't need to make less. They thought, well, the cost of the kit is $250, so we're going to charge $750 for the whole experience because $500 is enough. That's crazy talk. Number one, that's a money-losing proposition. But number two, what's enough? Have we been so brainwashed to think that our expertise, our knowledge, our time, all of the things that we study for hours and days and months and years on end is not worth the money that is printed on? Like, come on. Don't fall into that trap of not thinking that you're worth charging premium prices for. So my pricing journey has a very storied past. So I've been doing orthobiologics for quite some time. I've been using PRP and ultrasound guidance for quite some time. And I started out a couple of years ago or more, like 10 or 12. And I was charging, maybe $600 or maybe less. Maybe I started out with $350 and then I bumped it all the way up to $600. And $600 stayed for a very long time, probably 10 years. So number one, we know that's not the right price because nothing stays the same price for 10 years. But then two, I was nervous. I was like, how do I justify? As if the store needs to justify the price of bread. No, that's just the price. But we feel like we have to justify setting price at whatever level it is. And not that long ago, my eyes were opened. And I was actually able to calculate all of the costs involved with a PRP injection. And I finally bit the bullet and I said, all right, I'm gonna put it at $1,500. So that's from $600 to $1,500. Boom. And nothing happened. Patients didn't question why that was the price. They didn't stop paying that price. They continued to call me and continued to come see me to get orthobiologic injections. So I bumped it up $1,700 and then I bumped it up like the next week to $1,900 and nothing happened. And my patients still came to see me. They still wanted the service. They still chose to buy the injection-based therapies. And then I just kept bumping it up. And then I continued to bump it like monthly. And so we would bump it from $1,900 to $2,300, and then from $2,300 to $2,500. Along the way, we did start to also bundle these with other things. But again, the patients didn't stop coming to see me. They didn't stop paying that price for my expertise, for my knowledge, for all of the hard work and education that I've put into providing an impeccable service with impeccable skill, and outcomes I know are amazing because I collect my data also. So I know what I can present and I can provide these patients. And now currently I am definitely probably on the far end and a far cry from $350. So I've 10x'd that price that I started at. And so that's where I am today. And my patients are still calling, and they're actually traveling from different states, and they're calling me to get treated because of the effort and the time that I've invested in being really good at what I do. So now you've heard a lot of my journey on how I've kind of moved through this experience, and I have a practice that I absolutely love. And I have patients that I love to take care of, and they have great outcomes. And I track my great outcomes, and I'm confident in my great outcomes for my patients. But I didn't do it alone. I had guides along the way to help steer me in the right direction, make the right choices, make the scary jumps. They're holding my hand along the way when I'm like, oh my goodness, I can't believe I'm raising my price again. All of those decisions, I did not make in a vacuum. I had awesome guides along the way, and I still have guides to help steer and even just to say, yeah, you're doing it right. You're doing fine. And so I feel like I need to give back. It's my turn to be the guide and to be able to say, hey, absolutely, take the next step, nudge you along, keep going, you're doing great. Look at those outcomes. Are you telling me you're not an expert? Look at how good you're doing. And that for me is really exciting. I love helping doctors break free of the terrible experience that they're in now of that hamster wheel where you're going round and round. You're like, oh my gosh, it's Groundhog Day again. I can't even drag myself out. To this amazing experience where you're pinching yourself. You're thinking, oh my gosh, is this really my life? This is an amazing job. I get to take care of great patients and do great work for them and change their lives. And so for me to guide you is an honor. And I just hope that we are able to continue this journey to get you the success that you deserve.